Hi, this is Tom Heston, editor of the Internet Medical Journal, and this week's Journal Club article is Change in Mental Health After Smoking Cessation, Systematic Review and Meta-Analysis. The Primary Care Medicine Journal Club discussion will be held on Twitter at PCMJC using the hashtag PCMJC, or you can make comments on our blog at www.pcmjc.com. Now, this article was published just recently in the British Medical Journal. Let's go over it. First of all, the author's objective was to investigate the changes in mental health after smoking cessation compared with continuing to smoke. They did a systematic review and meta-analysis, and they ended up coming up with 26 studies that looked at mental health and specifically 6 measures: anxiety, depression, mixed anxiety and depression, psychological quality of life, positive effect, and stress. Now, what they did is they looked at the scores and they measured the quality of life and all those psychological measures before and after smoking to try to gauge the effect of smoking cessation on mental health. They found that the psychological quality of life and positive affect significantly increased between baseline and follow-up in quitters compared with continuing smokers. The effect size that they found was as large for those with psychiatric disorders as those without. The effect sizes, importantly, they were equal to or larger than those with antidepressant medication treatment for mood and anxiety disorders. That is, if you gave a smoker SSRI medication for depression, the effect of adding that antidepressant medication to their medical regimen would be no better than to just having the person stop smoking. Now let's go through this article. First, they looked at how tobacco is the leading cause of death worldwide, preventable death, with more than 5 million deaths a year attributable to smoking. And although smokers report wanting to quit, many continue because they think that smoking helps calm their nerves, helps give them mental health benefits. They use it to alleviate emotional problems, to alleviate depression and anxiety. And this pattern of behavior occurs whether or not the smoker has a diagnosed mental health disorder or not. And not surprisingly, views about smoking predict whether or not the smoker will attempt to quit and whether or not they are successful. So although smokers think that smoking offers mental health benefits, there's consistently been found a strong association between smoking and poor mental health. And smokers with mental health disorders tend to be heavier smokers and more dependent on nicotine and smoking. So although these smokers with and without mental disorders think that smoking provides them mental health benefits, in reality, they might be misattributing the ability of cigarettes to counteract nicotine withdrawal as a beneficial effect, rather than the smoking itself. We know smokers experience anxiety, depression, irritability when they have not smoked for a while, and that these feelings are relieved by smoking. Thus, it creates a perception that smoking has psychological mental health benefits, when in fact, it is the smoking itself that caused these psychological disturbances in the first place. And the authors go on to say, whatever the cause, smokers might be less willing to stop if they believe that their mental health will suffer. And furthermore, mental health professionals might be reluctant to intervene with some smokers because the mental health professional believes that smoking cessation might be detrimental to the person's mental health. Somewhat as a result, we know that people with mental health disorders have a life expectancy 8 years less than the general population. A full 8 years. And that much of this difference could be because they smoke so much and they tend to be heavier smokers. Now, this is a fairly complicated research method using a lot of statistical methods to come up with valid meta-analysis conclusions. Here's how these authors did it. First, they included broad eligibility criteria to try to capture all relevant studies. They used Medline, Embase, PsycInfo, Cochrane, collaboration data, and the Web of Science. And they also looked at the references given on each of these articles, and they did translate all of the non-English language studies to try to come up with all of the articles, all of the research ever done in this area. They wanted to maximize their sensitivity, and really they cast a very, very wide net. And they only excluded studies if they could not obtain data on the change in mental health and its variance. Importantly, the outcome measure was mental health in regards to a key reference and questionnaire to determine the change or improvement of mental health. So there had to be actually hard data associated with the change in mental health as related to smoking cessation. Again, they did a systematic review and meta-analysis of the results. They used Newcastle Ottawa Quality Scale and scale of 5 means that the research was very high quality, and 3 or lower there was more of a risk of bias in the meta-analysis articles selected. They also tried to look at outcome and reporting bias through a funnel method. They adjusted for covariates. They looked at loss to follow-up. They looked at methods to make sure smoking status was true or not. They tried to adjust for motivation to quit and the psychotherapeutic component within cessation intervention. Specifically, they did realize that successful quitters often attend smoking cessation clinics that include counseling, while relapsers cease attending. These people more likely to stop smoking continue attending these counseling classes, and so therefore one group might have had more counseling than the other. So they tried to account for this. Really in summary, these authors really tried to look at every possible variable, every possible explanation, and account for it in what was a very large meta-analysis study. They also looked at whether any association between cessation and improved mood could be caused by reverse causation. That is, the improved mood was the reason that the smoker quit. Okay? They looked at length of follow-up as well. Here's what they found. They found that, first of all, they initially identified 13,050 references. They sorted through all of those to make sure they got studies that included mental health changes, and they came up with 26 studies in the meta-analysis. The outcomes were 6 different measures of mental health: anxiety, depression, mixed anxiety and depression, positive affect, that is a positive outlook on life, psychological quality of life, and stress. Okay, here's what they found. For anxiety, they found that compared with continuing to smoke, quitting smoking was associated with a significant decrease in anxiety from baseline to follow-up. Then they looked at the mixed anxiety and depression. Again, compared with continuing to smoke, quitting smoking was associated with a significant, that is statistically significant, decrease in mixed anxiety and depression from baseline to follow-up. Same thing with depression. Compared with continuing to smoke, quitting smoking was associated with a significant decrease in depression from baseline to follow-up. Same thing with stress, and same thing with psychological quality of life. That is, in all 6 outcome measures looked at, in every single outcome measure, quitting smoking was associated with a significant increase in positive affect, anxiety, depression, mixed anxiety and depression, stress, and a psychological outlook on life in all 6 measures that they looked at. Okay? Now, the study quality, they found that even if they removed the very low quality studies, there was no difference. They looked at publication and outcome reporting bias and all of these other factors, loss to follow-up, motivation to quit, and none of them changed their conclusions. They even looked at motivation to quit, and they found that deterioration in mental health as a reaction for failing to quit was considered to be a very unlikely cause of the difference between quitters and continuing smokers. Okay, in conclusion, the authors found that their study showed consistent evidence that stopping smoking is associated with improvements in depression, anxiety, stress, psychological quality of life, and positive affect compared with continuing to smoke. And the 6th category is mixed anxiety and depression. And in all cases, smoking cessation seemed to be very helpful. The strength of this study is that they really did use broad terms. They cast a very wide net in trying to identify the studies that looked at this particular topic. They also even contacted the authors for additional data when necessary. Now they look at the possibility that the association is that improvements in mental health prompt people to attempt cessation, and that this explains the association. However, their data did not show that. Their data did not show that if a person became less depressed, then they would stop smoking. What their data actually indicated is that stopping smoking led to less depression. They look at a possible mechanism, and they present this one possibility, is that chronic tobacco smoking changes your brain and the nicotinic pathways in the brain, and that these adaptations are associated with occurrence of depressed mood, agitation, and anxiety shortly after a cigarette is smoked. They do realize that not all data support a causal interpretation. Not all of their data indicates that stopping smoking will actually result in improvement in mental health. They did show a strong association, and they believe that their data supports a causal effect. That is, if you stop smoking, you'll actually cause improvements in mental health. So, an interesting analysis that they did is they compared the effect size of stopping smoking compared to selective serotonin reuptake inhibitors that are frequently prescribed for depression and anxiety, and they found that stopping smoking was associated with an effect size as large or larger than the SSRIs in these particular conditions. And even if smoking isn't causal of the change, at least the authors say that their data should reassure doctors treating patients with mental illness that cessation is unlikely to exacerbate their symptoms and might indeed be therapeutic. Again, very cautious interpretation of their data. So in conclusion, the authors state that smokers can be reassured that stopping is associated with mental health benefits, challenging the widely held assumption that smoking has mental health benefits. And this knowledge could help motivated smokers to stop. Now, what we already know about this topic is that many smokers want to stop, but they continue smoking because they believe smoking has mental health benefits. What the study adds is that smoking cessation is associated with an improvement in mental health in comparison with continuing to smoke, and that the effect estimates are equal to or larger than those of common antidepressant treatment medications for mood disorders. Very provocative study and very interesting. I think the authors really did, or they really made a great effort at just trying to be fair and not over call or say too much more than their data really showed. So in conclusion, they found that stopping smoking is associated with improvements in mental health. They did think that it appeared to be a causal relationship, but they do recognize that more research is needed to confirm whether or not smoking causes improvements in mental health or whether it's just a simple association. The two run together, but there's no firm linkage. The effect of smoking cessation is similar to that of antidepressant medications. Now, to follow this journal club and to participate, please go to PCMJC on Twitter. You'll be able to follow us along using the hashtag PCMJC, and we look forward to discussing this article with you online. Bye for now.